Everyone, this is Dr. Paul Gundian with Restore in 24 Dental Implants, and today we're going to go over one of our patients as part of our case series study. So today we'll be talking about our patient, Miss Peggy. And here's Miss Peggy. She came in to look for a full mouth dental implant treatment. But here's another view of Miss Peggy's smile. So what we can see here is we have a lot of bone and gum recession here, missing our back teeth in both areas. Our teeth have drifted downwards over time, and everything's just very constricted. And so we're just trying to regain everything back here. And below on this bottom left here, you can see what the lab did. So we scanned our patient's mouth, and we were able to make digital models here of our patient just to study everything. Now here we have an x-ray of the mouth. So before, you couldn't really see exactly what was going on. We get a better view of what's going on here in the x-ray because our bone levels are supposed to be right around where my line is here, actually even a little bit higher than this, and we have bone levels right here. So we're missing a lot of bone here, and that's why a lot of these teeth are loose, and we're actually even missing, as you notice, all of our back teeth here, all of our back teeth here, and then we look on the lowers, and we have a ton of bone loss throughout here. So this level here, this is where the bone drifts off quite a bit. So all these teeth are very loose, and it bumps back up here. We're missing our back teeth here, missing one of our back teeth here, missing our back teeth here, and then this tooth is very loose, and this is actually an infection right here. So what we're looking to do is actually just replace all of these bad teeth with implants and get us to a better smile and better health. So here's another view of all of the different types of pictures of our 3D renderings of the patient's previous smile. So in the blue is what we have in the beginning, and what the white is where we propose where we want to put the teeth. So we wanted to bring everything a little bit back from where it was before. It's a little too pushed out in the front, but then in the back teeth we want to push those out, actually give her back teeth, and then on the lowers we want to move everything out to match with the uppers. So that's what this all shows here. And here's our digital smile design. So we basically took this last rendering that we had and we actually threw it inside of a photo of her so we can kind of get a good idea of where those teeth will be once we put them in the mouth. Here's the x-ray of the implants in. So what you can see here is we took out all the teeth and we smoothed everything out. We placed 4 implants on the upper right in front of these sinuses here. So we want to try to avoid these sinuses as best as possible. So as you notice, the sinuses are right around here and we avoided them here. Same thing over here. When we can, we want to avoid those. And then 2 in the front. On the lower, we want to avoid the nerve here. So we want to tilt the implants in front of the nerve so that we don't hit it. So we have 4 in the front and in front of the nerve, and then we have 4 on the top, 4 on the bottom. So these last photos here are all pictures of Miss Peggy and her permanent zirconia teeth that are attached to those implants. So as you can see here, her eyes are nice and bright and happy, and she got the smile that she deserved and wanted. And this last photo, we can really appreciate where we started and where we ended. So, you know, we brought those teeth back a little bit, gave us a full smile, made everything symmetrical, widened everything, and we got a big improvement in the smile here, and she's a happy camper.